In this documentary, we will be following a family who recently lost a child to Tay Sachs disease and are now in the process of deciding whether or not to have another child. Tay Sachs disease is a hereditary disorder that most commonly affects Jews of Eastern European descent. It is also a fatal disorder that normally causes death by age 5. In this documentary, the parents will learn more about this disorder, what causes it, and what their chances are of having another child that suffers from Tay Sachs disease.
Isaiah was a playful little boy. When he was born, he seemed healthy and seemed to be growing like any other child.
He was always so happy and joyful, and we thought that we had the most perfect little boy that could ever come into our lives.
When Isaiah was about 6 months old, we noticed that he wouldn't make eye contact with us. We thought that maybe he was just playing around. I started to realize this wasn't normal and told David that I think it was best to take him to the doctor.
A month after we first noticed the symptom, we took Isaiah to the hospital. I haven't had much experience diagnosing children with Tay Sachs, so when Isaiah's parents came to me with these symptoms, I did a physical exam on him. And when I saw signs that he might have Tay Sachs, I suggested that they get a blood test done the following day to confirm. A couple of days later, we got a call from the doctor asking us to come into the office the next day to discuss the results of Isaiah's blood test. We only prepared for the worst, but we didn't think that the worst could mean losing our son in a couple of years. I called Mr. and Mrs. Kaplowitz and told them that the tests had come back positive for Tay Sachs disease. We then discussed Isaiah's prognosis and what his symptoms would be in the following years. I told them they would become progressively worse and that he eventually would die within the next couple of years. I told them that they could expect such symptoms as seizures and decreased motor functions and mental abilities. I also told them about medications that might be needed if Isaiah's seizures were very bad, and also that he might need a feeding tube if he lost the ability to swallow. After that, I gave them a brochure on Tay Sachs and told them to go home because I knew it was a lot of information for them to take in.
After Isaiah's diagnosis, I quit my job so that I could stay home and take care of him. I knew it would be too hard and too expensive to be constantly rushing him to the hospital if he was having frequent seizures, so we opted to put him on medication in order to keep his seizures under control. My not being able to work was hard for us, especially since we had so many medical bills and we couldn't pay them because we didn't have insurance, and my yearly income just went down and we lost it, and so we only got $75,000 per year.
It was the hardest thing we will ever go through. Seeing our son in pain and dying was just taking all the strength that we had left out of us. But I think my wife did the best that she could to keep our son comfortable, and I think he lived the best life he could considering his condition. After Isaiah's death, the Kaplowitzes were trying to decide whether or not they should have another child. So I referred them to a genetics counselor who would help them make their decision and who could give them more information on why this had happened.
I have seen many cases of parents who have children with Tay Sachs that come to me wanting to know more information about the disease and how it occurs. Tay Sachs is a genetic disorder that is caused by a defective gene on chromosome 15. This defect in the gene means that the body cannot produce the enzyme hexosaminidase A. This results in a buildup of gangliosides, the chemical which is found in nerve tissue in the body. The buildup of this chemical is what causes the degeneration of neurological functions in the affected child. Most parents are unfamiliar with how this disease is passed down in families, and it is my job to educate them. Hi, I'm Dr. Hammond. Nice to meet you.
Hi, I'm Rebecca.
David. So I read the referral from your doctor and saw that your son recently died of Tay Sachs disease. Do you have any questions about the disease or what causes it?
Well, we know that it's a neurological disease, but we're not sure how our son could have it since neither of us has the disease.
Well, you do not have to be affected by the disease to pass it down, but you can be a carrier. This is called a Punnett square, and it helps to show the two alleles of the parents and how genetic traits are passed down. The two big T's here are dominant, and the two little t's are recessive. Dominant genes mean that you will not be affected by the disease, and the recessive ones mean that you are, or you are a carrier. If you have two big T's, you are not a carrier and you do not have the disease. If you have one big T and one little t, you are a carrier. And if you have two little t's, you are affected by the disease.
What we were really trying to see is if we should have another child or not, because it's just so hard to have another sick child, but also we're not sure if we're able to afford another child, more or less a sick child.
Now you see, since you're both carriers, you still have a chance of having a child affected by the disease. Even so, you only have a 25% chance. since you have these 4 options and they reshuffle every time you have another child. But you still have a 75% chance of not having a child affected by the disease.
So if you were in our situation, would you have another child?
Well, I'm not really in a position to make the decision for you. I can only give you the necessary information to make your decision.
Okay, well, you've given us a lot to consider, and we thank you for your